maximum people of our society that don't know how to take care of burn injury. They do some mistakes. What are the mistakes you should tell they should not do?
First basic thing is, if you ask to cool the wound, what people do is take ice and put the ice directly over the wounds.
Yes, yes.
What happens is, if someone puts the ice directly on the wound, it will cause more cellular damage. It will cause cold damage.
Okay.
So there is already heat damage to the skin. Now you are giving more cold damage to the skin. Just normal temperature water or normal tap water
Running
would be fine. Running water. You can just clean the wound or put in some bucket, and just that will be fine. No need to put ice or chilled water on the wounds.
Okay.
Second thing, people apply whatever people say around, or whatever they get. Usually people apply toothpaste, ink, Ratan Jot, whatever they get, just they apply. Some people crush the tablets and put that powder. So don't do all this stuff. Doing this will cause more chances of infection. So basically, skin is a barrier. It protects your body from all the sort of infections.
Yes, yes.
Skin is covering all your body completely. So if any infection is coming, if the skin is lost there, it is more prone to infections. You are directly putting something over it. So that causes more damage. And second thing is, if you cover the wounds completely with some other thing, whatever, toothpaste or ink, so whenever you consult a surgeon or plastic surgeon, there will be a difficulty to assess that type of wound. Usually,
Yes.
how deep it is, how superficial it is, we assess the wound looking on the wound, looking on the color.
Assessment only, just okay.
We'll assess the wound color. There are multiple ways to assess how deep it is or how superficial it is. It will be difficult for us,
Okay.
and there is a more risk of infection. So better not to do all this.
Shall we apply turmeric powder, something like that?
No, nothing. Nothing is required. Just get a medical attention immediately. That would be more better. Turmeric, all this all causes more contamination of the burn wound.
Okay.
Initially, when the burn has happened, the wound is sterile. It is not infected.
Okay.
So you put on whatever you keep on it, it will cause more infection. That would be more problematic than helping the patient.
So suppose a small superficial burn is there. For a small superficial burn, that is also required to visit the doctor.
No, if it is a small superficial burn, less than the size of your palm,
Yes.
then you can
Very
consider it. Then it is not required. If it is a small superficial burn, you can just have a small first aid at your home, and you can apply some topical ointment.
Topical.
Just skin ointment would be
Okay.
enough. Any
Okay.
antibiotic or basic ointment.
Okay.
Then take the wound care, proper wound care you take, that would be fine.
Many times we have seen that after small burn injury, basically blisters form.
Yes.
So people start popping it with something.
Yeah.
So what's your advice on that?
See, popping, this is also not advisable, because once these blisters have come, people usually pop it with a safety pin or
Yeah.
whatever is available. They pop it. The safety pin is not sterile, so it can cause infections. So once you pop it, you're introducing an infection. So
Yes.
you better, if there is blister, that means it is superficial to deep burn. You better get a medical attention immediately, so that there is no sort of infection. Once the dressing was done in a sterile manner, that time we can pop the blisters and we can do the dressing.
Okay.
That would be more advisable. So popping the blisters at the home is you're introducing some infection again
Okay.
on the wound.
I'm talking about whether you are staying in a rural area
Okay.
where there is no such kind of doctors available. In
Okay.
that conditions, how a person should take care.
Okay. In that conditions, any rural area, you can just basic primary healthcare or basic first aid. It is available everywhere. So you can go there. It can be just punctured, and it can be dressed.
Okay,
that would
doctor
be
will
more-
puncture that.
Doctor will puncture. That is more advisable,
Hmm.
because you don't know what you're puncturing it with. A small wound
Yes,
will be
yes.
converted into a bigger
Big.
wound, or it will take more time to heal.
Yes.
So it is better to get a medical intervention. If the blister is done, just go. One visit would be enough. It would take care. First dressing is done nice, then the patient will heal nicely if it is a small one.
Okay.